Hello, good morning. So once again, I'm Nurse Ken. So in this video, I'm going to teach you how to properly administer medication via intramuscular route. So this is very important for us to know to safely administer medication. But we have to understand the anatomy and physiology and also social legislations of different states. First and foremost, when you are going to administer medication, there are several routes, and one is via the muscles. So for the adult, commonly used muscles for adult is the deltoid muscle. Okay, now in this demonstration, I am going to use an infant dummy, baby Tina. So for infants, deltoid muscle should not be used. Why? Because it can only accommodate up to 1 ml. Now, for infants, we have to use this muscle, and this is what we call the vastus lateralis muscle. Okay, so administration of medication by intramuscular route in infants is commonly used like for immunization, administration of medication as ordered by the physician. So number one, we have to check the doctor's order first. Okay, so only licensed nurses or registered nurses, or in some state licensed practical nurses, is allowed to administer medication via um, the intramuscular route. Okay, so here are our materials to be used. We have our cotton balls with alcohol and dry cotton ball. We have our syringe, a plaster, an alcohol, and your prescribed medication as ordered. Okay, so first and foremost, after checking the doctor's order, you have to assemble all materials needed so that you can save time and energy, and also you can have a safe practice of medication administration. So after which, you have to identify your patient. Now, how are we going to identify patient properly? For adults, you have to ask for their name. Do not let yourself repeat or state their name. So, the most appropriate way is you have to instruct your patient to state his or her name, comparing with the wristband. Uh, on the other hand, for infants, you have to verify it with the mother or or the watcher or the relative, and you have to compare also with the wristband. Now, after verifying the patient identification, you have to prepare your medication. Now, nurses, registered nurses, and licensed practical nurses, they knew how to prepare that. Okay, we'll have that on the next modules for this. Okay, after which, now you're now ready to administer medication. So you have to cleanse, or you have to check the site, and you have to disinfect the site with your cotton ball and alcohol. So, what you're going to do is, since we're going to use the vastus lateralis muscle, okay, you have to clean the site from inner to outer motion. Okay, after which, okay, then you are now ready to administer, assuming that this syringe contain the medication. So by the way, just to give you a tip or more information, we have several parts of the syringe. Okay, so this is what we call the plunger. This is what we call the barrel. This is the hub. We have the needle, and on the tip of the needle, that's what we call the bevel. So it is very important for you, if you're going to administer medication, to know the different parts of the syringe. So like what I've said, assuming that this already contain medication of the prescribed medicine from the doctor. Okay, so after which, after cleansing the site, okay, so you have to get a cotton ball, prepare it in your at the middle of your fingers, so that you'll have an organized way of administration. Okay, after which, you have to locate the site. That's usually at the side of the thigh of the infant, and you have to grasp the muscle, and you're going to inject. Now, if you're going to insert the needle, okay, try to do the dart-like technique. It's a quick thrust technique like this. Okay, after which, anchor or hold the hub so that it can secure your syringe. Pull up the plunger, check for blood flow. If there is none, then you are safe. If there is blood flow, then you have to remove. Most likely, you have hit a blood vessel. So, assuming that there is no blood flow upon pulling the plunger, then you're now going to administer slowly the medication. After which, then you are going to um, apply direct pressure over the punctured site. Then, it is very important for safety precaution, do not recap the needle. So here are the common causes why health professionals such as nurses were involved in needle prick injuries, because most of nurses do recapping. So rule of the thumb, never recap. So some syringe are invented or designed to have a safety glider, in which you're just going to press the glide so that the needle will automatically be removed from the hub. So in this case, you can use your fish hook, or you can just drop it directly to the over the puncture proof container. So after which, you may secure your cotton ball using your plaster so that it can control bleeding. So please take note that upon securing upon applying direct pressure, it's at least you leave it for about 3 to 5 minutes. Then afterwards, you're good as good. So once again, thank you for watching this video and hope to see you soon. Bye.